I think, and this is truly my belief, that of all the surgeries that we do, hip replacement has the greatest impact on the quality of a person's life. People with bad hip arthritis are impacted in everything they do. There's no comfortable position. Oftentimes, if someone has a bad knee, if they sit or lay down, the pain is relieved. With hip arthritis, oftentimes sitting or laying down can actually be a more painful situation. So with bad hip arthritis, there's almost no position that's comfortable. And I don't think people truly understand how bad it's gotten until after they have the surgery done.
The basic reason that we do hip replacement is someone has osteoarthritis or degenerative joint disease. And those are confusing terms that most people don't truly understand. But it simply means that the cartilage that used to cushion the joint is worn out. And typically people who have that problem, they tend to develop pain that comes and goes. But over time it becomes more debilitating. The joint doesn't move as well, and the quality of life suffers from that. People aren't able to walk as far as they'd like. They aren't able to do the things that they'd like to do.
Typically, we run the gamut of non-operative care before we're talking about surgery. With hip arthritis, unfortunately, there aren't a lot of non-operative options that we do have. People can take medications. Physical therapy can often be helpful. Some people will try chiropractic manipulation. There are injections that can be done into the hip joint that often can provide temporary relief. But realistically, once the hip gets bad enough, then we do a replacement.
Hip replacement is about the best surgery we can offer as doctors. What it can do is greatly improve quality of life, greatly improve the overall health of the patient. I believe one reason people are living longer is hip replacement allows people to stay active. It relieves pain to the point where most patients don't even know they had the surgery once they've healed. With hip replacement, it usually feels very natural to the patient, and it can completely change someone's life in a positive way.
So when people come to see us, typically it's when the pain and or their level of function are really no longer acceptable for the type of life that they like to lead. And then our job is to come up with solutions for that.